I'm Bob Hardesty, a board-certified plastic surgeon practicing here in Riverside, California. Today's topic is facial rejuvenation, minimally invasive and short incision surgery. In our previous video, we talked about facial rejuvenation doing non-surgical procedures. What happens there is you think of the face as composed of two components. One is the skin, that's like the carpet cleaner. One is the structure, it's the carpet cutter. If you want to bring back the luster to the carpet, then you do a carpet cleaner. If the carpet has got stretched and has different rolls in it, you attach it to one side, called the carpet cutter. He pulls it tight and removes the excess. So the surgical revision is indeed the carpet cutter. So let's talk about that. Now, let's talk at the top. If we're wanting to get rid of these lines and the 11s, we can do what's called an endoscopic removal. We make 3 small incisions in the scalp. We put down a small tube that has a camera on the end, an endoscope, and we attenuate or we weaken those muscles. The reason that the muscles here sometimes fire and we get the wrinkles is we're trying to bring the brow up and wrinkle our forehead. And over time, those wrinkles become permanent. The brow is low, and we want to bring that up to the wide-eyed look and bring that tail of the brow up, which is the aesthetic goal. We may extend the incisions a little bit in the scalp and bring that together. Please look at our other blog on brow lift. We move to the eye. What happens with our eye? As we age, we lose elasticity and support. And what happens is, God created our eyes to be in fat pockets. These fat pockets protect the eye against trauma. But as we age, the ligaments get loose and the fat starts to protrude like this. If you look at my lower eyelid or look in the mirror yourself, shut your eyes and press, you'll see the fat start to bulge out. Well, when we go ahead and remove that excess skin and fat, that's called a blepharoplasty. Now, the next section, the midface. As we age, that midface starts to lose fat. The fat over the cheekbone goes away traditionally, and the fat along here remains, creating a dense nasolabial fold. The fat stays and drops in our jowl area, our neck. The muscles start to loosen. We get the turkey gobbler effect. So how do we do that? Depending on what you want and your facial anatomy, we can start with a neck lift. That tightens the neck. We can extend that up into the jowls and the midface, and that is called a facelift. A mini facelift just goes around here to undermine and really is for the upper face to tighten it. So people ask, where are the incisions? Well, the goal of the plastic surgeon is to hide the incisions and make them less noticeable. It's impossible to not have incisions and do structural surgery. Only in the movies in Hollywood can they do surgery without incisions or scars. So where do we hide them? For a facelift, we put them under your sideburn. We put it at the junction of your ear and behind the tragus. That's this little bump in front of your ear. And if I put that incision on the inside, there's no visible scar on the outside. It then goes down to the junction or crease of the ear and the face, and then it goes on the back side of our ear. Not in the crease, but on the back side, and tails up into the scalp or along the hairline. If properly done, and with good scar formation, you should have minimal noticeable scars, even wearing your hair up or going swimming. There's often a small little incision under here where we go ahead and tighten the muscles and do liposuction at the same time. Now, another alternative is to go ahead and make a small incision behind the ear and in the chin, and we do liposculpture, taking out all that superficial fat. And then we follow it with ThermiTite. ThermiTite is a little device that has a probe. It has a camera that we have out that measures the temperature of the skin on the outside and on the inside. And what this does then is shrink wrap the skin. It's like throwing a wet wool sweater into the dryer. It contracts down. Not as good as a facelift, not as good as a mini facelift, not as good as a neck lift, but can really work well, completely done under local anesthesia. Recovery time is minimal. Thank you.